Hello, and thank you for joining us for this 13 Connect special. I'm Angela Bakke, Community Affairs Manager here at Channel 13. As we are all well aware, the pandemic impacted everything. Most of our community put their health on hold, mentally, physically, and emotionally. So now it's time to get your health in check. Our top team of anchors and reporters did a deep dive into the most critical health issues facing our community in order to find solutions. We began with two of the key issues that really motivated us to put this health special together. Women turning to alcohol to cope with the stress of quarantining with both kids and work, as well as the social anxiety our teenagers have had to overcome. Here's our own Trisha Keene and Dave Crevassier with more on the toll taken.
For many during the pandemic, some lost a job, some worked from home. Many felt their stress levels spiking.
That's for sure. And all this week in our Health Check 22 series, we are looking at some of this year's biggest impacts on our health. And tonight, we look at a rising issue with how some women are choosing to cope.
You have a glass of wine in the afternoon and then carry it into the evening with friends, and it just became more accessible, easier, and something to do at times.
Joy Hoover admits it was easy to have a drink or two or three during the pandemic. Raising two small children and suddenly working from home, she found alcohol to be an easy stress reliever, but it wasn't a healthy one.
So at what moment did you realize, wait, this is an issue?
Yeah, I mean, really, alcohol just started affecting my anxiety a lot and it started affecting my body and my mental health.
Joy isn't an alcoholic, but she knew she needed to make a change, and she's not alone. In a report released just 6 months into the pandemic, the Journal of the American Medical Association found alcohol consumption jumped 17% among U.S. women.
We've seen a trend in just kind of in the lives of women who are dealing with a lot of stress. Alcohol use is a very easy and accessible way for us to kind of cope, and it's socially, condoned.
Michelle Doobie is Chief Clinical Officer at Landmark Recovery, providing substance abuse treatment for Las Vegas. She points out we're not necessarily experiencing a spike in alcoholism, but even the smallest increase can have significant repercussions.
When alcohol begins to impact our ability to do the things that were required of us, getting our kids to school, getting ourselves taken care of.
The Mayo Clinic reports women are increasingly affected by alcohol-associated liver disease and develop more severe disease with lower levels of alcohol than men. A major concern when you consider women are also less likely to seek treatment for alcohol-associated liver disease.
It's extremely important to always evaluate any behavior that we're having. Is this healthy?
The good news is help is available for anyone with questions.
There's a ton of professional help out there to help, and there's so many different levels of it. I think people think, well, I'm using alcohol, so I'm going to go into rehab. That's not all treatment. We have a wide continuum of care.
Landmark Recovery offers a helpline where recovery specialists are standing by 24 hours a day, 7 days a week.
If there's an affordability issue, there's options for that as well, and we can help, raise awareness about what options are available. It's a no judgment zone. That's what we do. We're just happy that you called and are making that step to change your life.
Taking that first step is key, and sometimes the hardest part. Anyone can feel the social pressure to hang out and have a drink.
If it doesn't make you feel good, if you are curious about what it feels like without alcohol, I would challenge you to try it. See how your body feels without it.
That's exactly what Joy did. She stopped drinking in January 2021 and says for now, it's what works best for her.
I realized it's okay. If alcohol does not work for my body, I can still be exactly who I am, have fun with my friends, hang out with my mom, mom friends, go on dates with my husband, and now we just order off the mocktail menu.
See, the mocktail menu works for her. And Landmark Recovery has specialists standing by for anyone dealing with substance abuse or anyone with questions. Just call this number right here, 725-217-9910. This story is part of our 13 Connects initiative, sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery. And one of the points that Joy had mentioned when I was talking to her, she said, this is a town surrounded by a lot of alcohol, and they try to push that for sales.
So the temptation's always there.
Yeah, she said, you really have to check yourself.
Makes sense.
Yeah. Well, so many Americans are feeling the pressure these days between COVID, working from home, inflation, and even the Russia-Ukraine war. Many are feeling so anxious.
All this week in our Health Check 22 series, we're looking at some of this year's biggest impacts on our health. Tonight, we look at the state of our mental well-being.
It was really bad. I didn't know how to calm myself down.
Last year, Brianna Arteaga noticed her anxiety was starting to get the best of her. The 15-year-old says she knew she needed help after breaking down at school one day.
I couldn't breathe and I just kind of felt overwhelmed. So I just couldn't. So I went to the bathroom and I started crying. I was like, well, why am I feeling like this?
Brianna turned to her mom for help and started attending an online group therapy session.
They talked about mindfulness and ways to deal with school and school stress and home stress and friends and stuff.
The pandemic kind of had this chain reaction of things that were happening to people that would never normally think that they would ever experience that level of stress.
Patrick Rogers is clinical director of behavioral health at Nevada Health Centers. He says the pandemic had a major impact on every demographic, but especially teenagers.
I think the biggest effect was really on our high schoolers, on the adolescents, again, because of that social piece, right? Kids want to fit into a group, and all of a sudden there was no group to even be a part of.
As a result, Rogers says Nevada's experiencing an increase in teen drug and alcohol use and thoughts of suicide. The biggest issue is reaching the teens as well as adults who need help.
Access has always been an issue for the Nevadans to get in to see a behavioral health provider, get in and see one on time and consistently.
Historically, Nevada, among the states, has been one of the lowest in its budget for mental health. Is that still a challenge here?
Absolutely. It is absolutely. Nevada's ranked dead last. We're 51st in the nation since 2011.
Rogers says he feels the state's hands are tied as many programs are experiencing budget cuts, including behavioral health. But he says it's not just a lack of funding.
It's a workforce issue as well.
To address that issue, in the long term, Rogers says recruiting programs are actively educating middle school, high school, and college students about careers in the healthcare field.
And again, with the pandemic, if you think about it, there's more people that are actually seeking help.
Crisis Support Services of Nevada is one place where many are turning for support. Executive Director Rochelle Pelletier says their 24-hour hotline is experiencing an increase in escalated calls.
When someone calls in, they are much closer to that imminent risk to themselves or someone else, and we're having to deploy emergency services much more frequently.
Just like Rogers, Pelletier says it's the youngest demographic that seems to have been hit the hardest.
Our kids are struggling, and we see it especially now.
To reach those kids, Crisis Support Service staff and volunteers are willing to speak with and even text with anyone needing their help.
They'll go into the bathroom at school and text us because they're they're depressed, they're anxious, they're having a panic attack. What we've found, when we give kids our phone numbers, they use it.
And that's the good news. More kids and adults are willing to seek assistance these days. Rogers says that's one of the highlights to come out of all this.
The pandemic, for all the issues that it really caused, really opened our eyes as the general public to an acceptance of what mental health really is.
Brianna Arteaga agrees and has a message for anyone considering reaching out.
It's okay to not be okay, right? Let someone know. Just talk to someone. It really helps just to talk about it. If you keep it in, it's not going to make anything any better.
So if you or someone you know needs to talk, call Crisis Support Services of Nevada. The number's 800-273-8255 or text the word CARE to 839-863. Their lines are open 24 hours a day, every day, offering free and confidential support. This story is part of our 13 Connects initiative sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.
We have much more to cover today. We'll be right back.
Our company was founded with a mission to unlock human potential, so we see every day as a new opportunity to change lives and build a healthier community. So much of what we do in addiction treatment relies on the support of local nonprofit organizations like support groups, advocacy organizations, and volunteers. It is so powerful when we come together as a community under one goal. You can see this in the recovery community here in Las Vegas. We've been so lucky to partner and volunteer with local organizations to provide resources for individuals and families affected by substance use.
Our main goal is to connect as a community instead of outsiders being those that are in recovery, maybe those that are struggling with addiction or substance abuse, and recognizing that it's all of our problem. So it doesn't matter where you live, what aspect of life you are in, that substance use disorder just doesn't discriminate.
Whether it's working with the Darren Waller Foundation to provide access to treatment for young men, or working with Second Chance 5K to provide support to families affected by substance use. We focus on helping reduce the barriers many people face when confronted with addiction. Also, our employees are passionate volunteers and work with local support groups or other organizations that are vital to the long-term success of our recovery community. At Landmark Recovery, we have a vision to save 1 million lives over the next 100 years. But we know we can't do it alone. Only together can we build healthier communities.
Crisis support services of Nevada staff and volunteers are available 24/7 to help those struggling through trauma and crisis. Call 1-800-273-8255. Text LISTEN to 839-863 or visit cssnv.org. 13 Connects is sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.
Welcome back to Health Check 22, a 13 Connect special. And now, Alicia Patillo shares with us why early detection may happen younger than you think.
Colorectal Cancer Awareness Month, and while the screening age for colon cancer is now 45, health experts are reporting a rise in cases in younger people, especially African Americans.
And as part of our Health Check 22 series, 13 Action News reporter Alicia Patillo shares how early detection saved a Las Vegas woman. Alicia.
Hi, Dave and Tricia. Well, we've all had that feeling in our gut when we know something just isn't right? In this case, that feeling saved a young woman's life.
I knew something was not right.
Tennille Pritchard's pain in her stomach started slow, eventually leading to digestive problems. Hoping a trip to the doctor could fix it, but convincing others would be a challenge.
I was telling my primary care doctor, and he was kind of just saying, you just need to do normal things. Drink more water, up your fiber.
At 38 years old, Tennille went with her gut, seeking answers she couldn't find with her primary doctor.
I ended up making an appointment on my own just because I knew something was not right. I went in, GI doctor kind of was like, well, we have to do a colonoscopy just to see what's going on.
In May of 2021, when Tennille woke up from colonoscopy surgery, the answer was there.
He found a huge tumor and told me that I had cancer.
Tennille was diagnosed with stage 1 colorectal cancer at 38. Her family has no history of colon cancer. Her age is alarming for many who are told by doctors screening for colon cancer starts at 45. But for the last decade, research shows colon cancer increasing in younger people. The passing of actor Chadwick Boseman shocked the world when he died of colon cancer at just 43. So we asked an expert, is it time for the screening age to drop?
Absolutely, and I wouldn't be surprised to see that it will be even lower in the near future.
Dr. Shung is a colon and rectal surgeon, professor, and expert here in the Valley. Not only does he say that the age should be lowered for colon screenings, but this cancer is disproportionately affecting the Black community.
Colon cancer is the second highest mortality cancer on the globe. Specifically among the African Americans, they have the highest incidence and mortality rates among all the ethnic groups here in the United States.
Many factors can play a role in the increasing number of Black people diagnosed with colon cancer, such as genetics, social economics, and fair access to health care.
Being African American, I going to all different types of doctors, just being taken seriously. When you say, I don't feel good, something's wrong.
While closing the gap in healthcare disparities is an uphill battle, and early detection is still key, Tennille says the best advice you can take, listen to your body.
Tennille is 39 now, and she is in remission, and she is just such a warrior. I just was so inspired by her story. She did what needed to be done so she can save her own life. Tricia and Dave.
Yeah, we wish her the best of luck with her health. And I know, Alicia, this is a topic that really is dear to your heart.
It is. As many know in the studio and in the newsroom, I lost my mother at age 4. She was 42 when she was diagnosed with colon cancer, and 15 months later, she died at 43. And she was in stage 4. So getting tested early is so big in my book. If you have any questions, please reach out to your primary care doctor. And if they don't listen, go to someone else. Yeah. There's always an answer.
Right.
That's right.
Great testimony, Alicia. Thank you so much.
Yeah,
this story is part of our 13 Connects initiative, sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.
We'll be right back with more for your health.
Subaru Love Promise, we talk a lot about that. It really is the guiding principle. It's the guiding light for our brand, for our store, for the Finley Automotive Group. I mean, it goes hand in hand with what the Finley family has done for so many years here, since 1961.
Subaru Loves to Help and Subaru Loves to Care are integral pillars of the Subaru Love Promise. And so everything that we do needs to be geared to helping others and making the world we live in a better place. So whatever that need is, we want to reach out and help meet it. I believe it goes back to the Subaru Love Promise that really compels us to engage with the needs in our community.
I think this city is a great city. I think there is a cohesiveness here that doesn't exist in a lot of places. And it really comes from the heart, for caring for one another, for seeing a need and filling it. Every day that I come to work, I look for opportunities. I pray for opportunities to be a blessing to other people, whether it's to my own staff or whether it's to a customer that's coming in the door. I want all of our associates here to have that same attitude of serving, because I really believe that serving each other is what makes life worth living. We just gave a check to a local school to help them with their PE equipment, and $1,000 can go a long ways and make a big difference in the lives of elementary school kids. Subaru of Las Vegas is here to serve the city, here to serve the people, the community.
Welcome back. They take care of us, but who takes care of them? Tricia Keene sat down with some of our hometown heroes, our healthcare workers, to hear what the past 2 years have been like for them.
Well, the last couple of years have been tough on just about everybody, but it is fair to say healthcare workers may have gotten the worst of it. All this week in our Health Check 22 series, we're looking at some of this year's biggest impacts on our health. Anchor Tricia Keene spoke with an expert who says many of our doctors, nurses, and social workers may not be getting the help they need.
I imagine it's been difficult to see what you've seen in the healthcare industry.
It sure has. Yeah, it's been a challenge for many healthcare workers.
Sandra Reichart is owner of Executive Therapy Solutions. As a clinical social worker, she says her entire industry has felt the physical, mental, and emotional impact of the pandemic.
You're always on call. It's very high stress, but during the pandemic, it was ramped up exponentially.
Reichart fears many healthcare workers aren't seeking the help they need.
I would say we have not seen the worst of it. You'll see people coming in maybe 6 weeks, 6 months from now, really struggling with some terrible self-conflict and depression.
She says many of her clients are experiencing job burnout from being overworked and feeling unappreciated. At one point, there was a real push to recognize our healthcare workers as heroes. But Reichardt says many simply didn't feel the love.
What we found was that the celebration of this heroes work here was substituted with a lot of hostility towards healthcare workers. A lot of the pandemic became so politicized that a lot of healthcare workers became really depressed over it.
The unknown of saying what's happening with our country right now, that was the scariest part.
Registered nurse Brian Panessa says every time it felt like things might get back to normal, hospitals were suddenly taking 2 steps back.
I think every day was different when I walked into the hospital because us as nurses, we didn't know what area of the hospital we were going to be working in.
Panessa says the main reason for that was staffing shortages.
You know, when the nurses come in, they're like, yeah, I'm not really feeling good. Gone, go get tested. You know, and then you, as a nurse, myself, have to step up to fill the void of them not being there anymore.
It was a daily challenge, he says, was taxing on everyone.
You're like, I have so many tasks right now that I can't even be distracted by something else.
So Panessa made sure to take time and decompress every day.
As soon as you clock out of work, for me, I mean, I would sit in my truck and just breathe and just calm down from the day and just let it go.
Reichardt says that's the key. Everyone needs to find an outlet, but so many in the healthcare industry still haven't taken time to just stop and breathe.
Regardless of what your name badge says, what letters you have after your name, at the end of the day, you are a human being. It takes a toll on you.
What would you say to the person who says, you know what, I don't need help?
Well, I would say that that's very courageous to feel that way. And we often do feel in our industry like we don't need help. We've got this. We've been training for it. But to take a moment every day and be mindful.
If you're concerned about yourself or someone you know, Reichardt says there are some important questions to consider. Are you losing sleep? Are you getting sick more often? Are you missing a lot of work? Are you experiencing low morale? And are you isolating yourself?
These are really important indicators of anxiety and depression coming on. And I think that's when you really want to reach out to a mental health professional and say, hey, I need help.
For 13 Action News, I'm Trisha Keene.
And if you are looking for help, there are a few supportive organizations. Reichardt recommends a couple, including Las Vegas Heals and Vegas Healthcare. Panessa also wants to do his part. He's actually left full-time nursing to create the organization Fit Functional Nurses, aimed at providing benefits and incentives to other nurses. We have more information at ktnv.com/healthcarehelp. And this story is part of our 13 Connects initiative, sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.
We will be right back with more Health Check 22.
The Hope for Kids event, it's important to us, and as an organization we wanted to get involved and participate because that is the foundation of what we believe in, is giving back and helping people. You know, there's such a need in our community. There's so many people struggling, whether that's for food or whether that's for clothing or shelter. There's so many needs, and as an organization we look for opportunities to be able to give back, and that's why we wanted to be involved. We have been giving back in a number of ways for many years. It's, again, the foundation of our organization, and it's something that we look forward to each year. It's something that we encourage our employees to do. We ask them to get involved in the community. We ask them to tell us something they're passionate about. We just wrapped up our 17th annual food drive for the organization. And again, this was a great opportunity for our members and employees to come together to make contributions to individuals who are in need. Our employees love to participate. Any challenge we give them, whether it's the food drive, Warm the Souls, you know, whatever it might be, they jump in wholeheartedly. There's lots of competitions between departments and branches, but everyone gets involved, and we see a tremendous participation from our employee group. For the future of giving back, I see that continuing to grow. The credit union is very focused on this. We've created a foundation specifically for this called the America First Charitable Foundation So we're always looking for opportunities to be involved. We have pillars of service areas, children's services, veterans, community social initiatives. We want to be able to provide in our communities, and this foundation is helping us do that. If you want to find out more about America First Credit Union and the America First Charitable Foundation, go to americafirst.com. There's lots of information about our programs, things we've been involved in, and we'd love for you to learn more.
Next, in our Health Check 22 special, Dave Courvoisier explores our first post-pandemic healthcare issue, a backlog of patients who need to have a primary care doctor, but we just don't have enough doctors to see them.
When the pandemic hit, it forced many businesses here in Southern Nevada and across the country to close. Even as essential workers, many doctors' offices were also affected. Well, all this week in our Health Check 22 series, we're looking at some of this year's biggest impacts on our health. And tonight, anchor Dave Courvoisier has the effort to get patients back in the exam room.
I had candid, difficult discussions with patients, family members, right, to say, hey, this is not one at this time that we can provide you care for.
Dr. Saju Joseph says the pandemic is like nothing he's ever experienced. In the early months, the surgical oncologist was limited from doing everything possible.
Screening, from colonoscopies, mammograms, all those things were really kind of shut down.
Did people die or have too much advancement in their problem because of this?
Absolutely, 100%. I will tell you, the thing that probably scarred me the most was the people who passed away who couldn't see their loved ones.
But even as the healthcare industry eased restrictions, other issues slowed the process.
You had not only the patients that were established, you had new patients coming, and you then had the third crunch, which was providers leaving.
Dr. Joseph says many doctors were quitting, retiring, or moving to non-clinical jobs. Dr. Christopher Mercado, Chief Medical Officer with Dignity Health Medical Group of Nevada, was among the many doctors taking on new patients.
In Nevada, we're 48th in the nation in terms of doctors per capita. So we are not only on a backlog of patients who need to be seen from the pandemic, but also at a backlog of patients who need to have a primary care doctor, but we just don't have enough doctors to see them.
Dr. Mercado says his office and others are getting patients back on track with the help of nurse practitioners and telehealth. But he says there's still a lag for some medical specialists.
Maybe it would take 7 to 10 days for an ultrasound. Now, because there's so many people here who need imaging, whether or not that's chest x-rays, mammograms, that can take 4 to 6 weeks to get that done.
Dr. Mercado says those delays are taking a psychological toll on patients.
I think that's really what we're dealing with now on the primary care setting, is how the waits in terms of like imaging or elective procedures are starting to affect patients.
Dr. Joseph agrees with the prognosis.
Best example here, if you need to be seen by a rheumatologist, it's a 3-4 month wait, and we're hustling to get these people in. And these aren't diseases that can just sit at home, waiting.
For those who can wait, Dr. Joseph says the good news is a lot of patients are getting the help they need outside the hospital.
I would have told you 2 years ago, pre-pandemic, probably a good 80-90% of what I did was in the hospital. And now I tell you probably 50-50. We can provide pain control, fluids, and care for you in an outpatient setting.
But there's one more major hurdle facing many doctors, reaching those patients who have completely stopped seeing any doctor during the pandemic.
Still trying to get out to the community and say, right, if you need something, right, if you need to be screened or you just need to be seen, we're here. We are putting patients in everywhere we can fit them. We are gonna, if we get somebody referred over, we're gonna fit them in as quickly as we can.
Dr. Mercado is prescribing the same advice and says everyone should be getting back into the habit of seeing their doctor regularly.
Really important for us to catch things early, get patients in for the annual visits, and have blood work done to make sure we're taking care of them ahead of time.
Dave Courvoisier, 13 Action News.
And this story is part of our 13 Connects initiative, sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.
Well, that does it for this 13 Connects special. Wishing you all good health from all of us here at 13 Action News. Find these stories and more at ktnv.com.
Crisis support services of Nevada staff and volunteers are available 24/7 to help those struggling through trauma and crisis. Call 1-800-273-8255. Text LISTEN to 839-863 or visit cssnv.org. 13 Connects is sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery.